Welcome back, everyone. Well, we are continuing our Women's Health Month series. The world of fertility is constantly evolving with more diverse families and with some struggling with infertility. There are more options than ever for family planning. Reproductive endocrinologist and infertility specialist Dr. Irene Wu joins us now with some insight. Good morning, Dr. Wu.
Good morning. Thank you for having me.
Thank you for joining us. This is a very important topic that we're hearing more of these days. You know, doctor, with so many couples of all backgrounds wanting to become parents, explain what types of treatments are available to them right now.
Yes. So I think first and foremost, infertility is a disease of the reproductive system. It's not an inconvenience. It's not a personal failure. It's really a medical disorder of the female or male reproductive tract that can prevent conceiving a child or carrying a pregnancy to delivery. So there's been wonderful treatment options that are available for patients, but I think the most important thing is to have an evaluation so that we can actually understand your diagnosis, which is crucial for us to pick the most suitable treatment option.
And what are the most, I guess, common treatments out there?
Yeah, so one of the most common evaluation that we get for patients is IVF.
IVF, yeah.
So it's in vitro fertilization, and it's a method of reproductive assistance where we can actually combine the sperm and the egg outside of the body in a laboratory setting in a petri dish. And then we transfer that fertilized egg, that embryo, back into the uterine cavity.
It's not a simple process. I know personally family members who've gone through it. This can be extremely emotionally difficult.
Infertility treatment actually has a lot of emotional component to it. One of the things that I actually am very happy about in the last couple of years is that there's a lot more social media awareness of infertility treatment. I think a lot of brave women and couples have been very open and vulnerable about their journeys, and you know, to let other patients know that they're not alone. The WHO actually put out a really important statement this year after an extensive literature review that globally, they estimate 1 out of every 6 people are affected by the inability to have a child. So this really impacts millions of people.
That's a very sad and staggering statistic. You just talked about the WHO, the World Health Organization. Let's talk about a study, the latest study by the CDC. They published this study in April, and they found that the U.S. fertility rate just recently dropped to another historic low. What do you think is behind this dramatic drop?
One of the biggest, I think, is just a lot of couples are having their first child a lot later in life. The largest age group of people having children is 35 and above.
Wow.
And so it's normal biology and normal physiology for a woman's age to affect the quantity and quality of the eggs that they have. It's normal biology. And so I always tell patients that, you know, a healthy woman in her late 20s, early 30s probably has about a 20-25% chance of getting pregnant every month. But at 40, it drops to below 10%.
Wow.
So I think that's probably one of the biggest factors. There's other social components. I think having a support system, having a financial kind of readiness for having a family. I think all of these things are also contributing to starting families later in life.
When couples come to you, what are the realistic expectations they should have? You know, it's not always a 100% success rate.
Yeah. So I think it depends on the particular situation. So I think this is really why it's so important to have a comprehensive diagnosis and evaluation, because every person's journey is different. And your particular journey and your particular situation will change our prognosis. So I think there's no way to give a set answer until you're actually seen by an infertility specialist. Yeah.
For a lot of couples, the cost is a major factor. Treatments, are they covered by insurance? Is it out of pocket? Can you explain?
Yeah, so that's a great question. So at the end of my consultations, you know, we go through all the medical evaluation, but then there's a component of this which is a financial consultation.
Sure.
And there are more and more employers that are actually offering coverage for infertility treatment, which is great. But I think there's definitely more advocacy that can be done. So Resolve is a great program that actually will help patients talk to their HR department, write to their state legislator, because I think these are really important voices that need to be heard to help advocate for fertility coverage.
If there are couples out there watching this story this morning, what's your message?
Yeah, so I think my biggest encouragement for women and couples out there is that they should see a reproductive endocrinologist as soon as possible. This gives us an opportunity to just figure out if there's any issues, to help you treat any issues, and really help you achieve your goal of your family. I've had a lot more patients coming in for egg freezing, which is kind of a way to like stop the clock for a lot of young professional women. And I kind of want to just encourage all women at 30, if possible, to see an infertility specialist just to understand your reproductive health. Have an evaluation. I think it's really important to understand your body and have the information for you to make an informed decision of what you want to do for your reproductive future.
Dr. Irene Wu, thank you so much for sharing all this helpful information. And you can find all of this information on our website, kcalnews.com/SeenOnTV.